Patients often ask me whether hip replacement surgery will change the length of their leg. Certainly the goal of hip replacement surgery is to give you a comfortable, pain-free hip with leg lengths the same on both sides. This is a model of a hip, and keep in mind that the plastic is your bone. The only replacement parts are the metal socket, the plastic liner, the ball, and the wedge. So in traditional or conventional hip replacement surgery, when the incision is done through the back of the hip, the ball sometimes needs to be made longer so that the hip remains stable, so the hip does not dislocate. This is the ball portion, and it can be made short or long depending on what the surgeon feels is necessary to keep the ball in the socket. On the other hand, when the surgery is done through an anterior approach, which is certainly my preferred approach, I do the surgery through the muscles in the front, and I split the muscles to be able to do this surgery. I implant the same components, but it has the advantage of having a much more stable hip. And that has the advantage of making sure that the leg lengths are the same from side to side. So in surgery, I do the replacement, I put in my trial parts, and I can get an x-ray of this side and compare it to the other side and make sure that the lengths are exactly the same. That's why I prefer to do an anterior approach, because I can make sure that the leg lengths are the same, that the hip is stable, and that way you have a much better chance of having a comfortable, pain-free hip replacement surgery.